Welcome to week 13. It's the start of your second trimester. Your baby is now the size of a cookie. Your baby has developed a lot by now. His arms are about the right length for his body, but his legs are a little stubby. He's even creating and peeing out his own urine into the amniotic fluid. He's also starting to grow his own fingerprints. You're growing too. While many women gain upwards of 5 pounds in the first trimester, most start gaining as much as 1 pound a week from now until birth. Most women gain about 15 pounds during the second trimester. You don't need to eat for 2. Technically, you only need about 300 extra calories a day when you're pregnant, which is about 1 extra piece of fruit and a cup of yogurt. Now that you've gotten over the hurdle of the first trimester, you're probably less nauseous and finally have more energy. You may, however, find you have more nasal congestion. About 40% of pregnant women experience what's known as rhinitis of pregnancy. This kind of stuffy nose doesn't come with the other symptoms of allergies, the common cold or the flu. Higher levels of estrogen make the mucous membranes swell and produce more mucus. Some cold medications aren't safe during pregnancy. Check motherrisk.org if you aren't sure. You can treat congestion safely by rinsing your nasal passages with saline water, taking a warm shower in a steamy bathroom, using over-the-counter saline nose drops or a vaporizer, or by adding an extra pillow to keep you propped up at night. Although not all experts agree, some doctors recommend that you don't sleep on your back during the second and third trimesters. That's because doing so puts the weight of your uterus on a large vein called the inferior vena cava. This can interfere with digestion and circulation, cause backaches, and affect the baby because it reduces blood flow to the fetus. The optimal sleeping position for blood flow during pregnancy is on your left side. Left is best, might help you remember this. Many women find that they feel better when they sleep on their sides, with a thick pillow propped between their knees or snuggled against a full-body pregnancy pillow or bolster. If you wake up on your back, don't panic. It's your body's way of telling you to roll over. Just switch positions. But here's a surprising pregnancy perk. Surging hormones can make you feel extra horny, and increased blood flow can make your orgasms even better. Sex is perfectly safe during pregnancy. Women with low-risk pregnancies can have sex right up until their water breaks or they go into labor. Congratulations, you're going to be a great mom. Welcome to week 14. Your baby is now the size of a pickle. She's growing a layer of peach fuzz. The fine hairs, called Lanugo, help protect her skin and keep her warm. As your baby fattens up in the last weeks of your pregnancy, she'll slowly lose that hair, though some babies born early are still a little furry. As for you, your boobs may not be as tender as they were in the first trimester, but they're going through other changes. You might notice that your areolas are getting bigger and darker. Thanks to your growing uterus and the progesterone in your body, your pelvic bones are slowly stretching apart as the abdomen expands, often called round ligament pain. This often feels like a dull ache around your hips or sharp pains when you change positions. If it seems more intense or the sharp pain lasts longer than a couple of seconds, call your doctor or midwife. Your growing uterus is putting pressure on your bladder, making it harder to empty it completely and more likely for you to develop a urinary tract infection. You can help prevent UTIs by drinking plenty of water and peeing before and after sex. If you think you have a UTI, it'll feel like it's burning when you pee. It's important to get treated with pregnancy-safe antibiotics prescribed by your doctor. Untreated UTIs can lead to kidney infections, preterm labor, and serious complications. The increased estrogen in your body also makes you more susceptible to yeast infections. To lower your risk, wear cotton crotch undies, sleep commando, and take showers instead of baths. Here's another surprising pregnancy symptom: bleeding gums. Hormonal changes can make your gums more sensitive, making it harder for the bacteria in your mouth to fight off plaque-causing pregnancy gingivitis. In fact, most moms-to-be have soft or bleeding gums. You may notice you're having a harder time sleeping. Between heartburn to worrying about your baby to having to pee all the time, it's tough getting a good night's rest. Getting exercise early in the day, restricting screen time and smartphone use near bedtime, and sleeping in a dark, cool room can help you sleep better. And if all that fails, at least your new night owl habits are good training for when the baby comes. Don't forget your immune system is suppressed during pregnancy. So if you haven't gotten the flu shot yet, you should. It's safe during pregnancy, and as a bonus, your baby even keeps some of the flu antibodies from it after birth. Congratulations, you're going to be a great mom. Welcome to week 15. Your baby is now the size of a tomato. This week, your baby is practicing his facial expressions: frowning, grimacing, squinting, and wincing. His hands are also making little fists, and he can even grasp them together. Your baby can also hear now. Between your heartbeat and the blood coursing through the umbilical cord, it's actually pretty noisy in your uterus. Your baby can hear your voice too, and it's important to him. By the time he's born, he'll remember it. Studies have shown that newborns prefer their mom's voices to those of others. As for you, you're probably feeling pretty good. And if you're lucky, you may even have that pregnancy glow, which is caused by a combination of increased blood flow, hello rosy cheeks, and oil production in your skin. You'll also probably find that your nails are growing faster and stronger, and that your hair is thicker as well. If you're not feeling the glow, though, you're not alone. Pregnancy doesn't agree with everyone. A surprising symptom you may be experiencing is depression. Most people are familiar with postpartum depression after the first few months of caring for your baby, but it's also fairly common for depression to develop during pregnancy. Up to 23% of women struggle with prenatal depression symptoms, including difficulty concentrating and sadness or anxiety that impacts your ability to work, socialize, or parent your older children. If you're worried, talk to your midwife or doctor. Possible treatments include support groups, cognitive behavioral therapy, and certain antidepressants. Between now and week 20 of your pregnancy, you'll have the option of doing more tests to screen for neural tube defects. You'll either have a quad screen or integrated biochemistry. The results will tell you the likelihood of your baby having neural tube defects such as spina bifida, where part of the neural tube doesn't develop or close properly, and anencephaly, where a defect in the neural tube causes an underdeveloped brain and skull, but not whether your baby has the issue or not. If you haven't already been tested to determine your baby's risk of chromosomal differences like Down syndrome, this test can tell you that as well. Here's your first to-do that's just for the baby. Find him a doctor. You might be surprised to learn that your baby doesn't necessarily need a pediatrician. He can also see a family doctor. If you have a primary care provider you love, consider asking her to take your baby on as a patient. Congratulations, you're going to be a great mom. Welcome to week 16. Your baby is now the size of a donut. Your baby's moving around and making her first voluntary movements. She might even be sucking her thumb in there. Remarkably, if you're having a girl, her teeny tiny ovaries are starting to develop hundreds of thousands of her own eggs. You might look really pregnant by now. Your belly will pop sometime in the second trimester. Even though your baby has been moving around for a while, she's big enough now that you might feel her kick. Your baby sleeps almost all the time, so it's okay if you don't feel her for a while. The location of the placenta can also insulate her kicks and movements. Back pain is super common during pregnancy. Your ligaments are relaxing and you have extra weight on your belly and boobs. Meanwhile, the muscles in your abdomen are separating to accommodate your growing uterus, which means that they're no longer knitting together to support the lower back. All of this translates to soreness and pain. To counter it, focus on having good posture, wearing low-heeled shoes, sleeping on your side, and staying active. If the pain persists, acupuncture and massage can help. Do you feel like a klutz lately? It's not in your head. Your growing belly is shifting your center of gravity, making you more apt to lose your footing. You're also tired from all those nighttime wake-up calls, and not being able to see your feet doesn't help either. Pregnant women are as likely to take a tumble as 70-year-olds, so it's time you started acting like one. Wear flat shoes with good grips, use the handrail when going downstairs, and tread carefully. If you're starting to feel like pregnancy is taking its toll, you might want to give prenatal yoga a try. The exercises can help combat back pain, headaches, anxiety, and sleeplessness. And the breathing exercises can help you handle the shortness of breath that comes later in pregnancy. Be sure to look for a teacher who has experience with pregnant women. Congratulations, you're going to be a great mom. Welcome to week 17. Your baby is now the size of a taco. She's starting to pack on fat, turning into a cute, squishable baby. She's also starting to grow eyelashes and eyebrows. As for you, you're probably capital H hungry all the time lately. Your belly and boobs are getting more impressive every day. But with all that stretching, your skin can feel itchy, so be sure to moisturize frequently. You might also be suffering from heartburn and indigestion, have increased vaginal discharge, and be sweating more thanks to increased blood flow. Some people call it a pregnancy glow. Sure, let's go with that. Weird fact, did you know that your placenta will grow about 50 kilometers of blood vessels during pregnancy? If you're already feeling your baby kick, you might start to notice that she moves in response to sounds or when you eat something she likes. Pregnancy headaches are common and annoying. They're just one more thing to thank your hormones for. You can help prevent them by trying to get as much sleep as possible, staying hydrated, and eating regular snacks. To reduce their severity, try taking a nap, drink lots of water, or pop a Tylenol. Acetaminophen is safe to take during pregnancy in lower doses. If you have a partner, this is a good time to start talking about what life's going to look like after the baby arrives. Who will do the housework and who will cook? How will night feedings work? Is co-sleeping on the table? What about sleep training? Talking through it all now will help make sure you have realistic expectations when the baby comes. If you're thinking of taking a baby and toddler CPR or first aid class, you might want to do it now, before your belly gets too big and bending over crash test dummies to perfect your technique becomes uncomfortable. You'll learn what to do if your baby chokes, how to perform CPR, and how to deal with more serious cuts and scrapes. Congratulations, you're going to be a great mom. Welcome to week 18. Your baby is now the size of a large cupcake. His taste buds are developing, and he can actually taste some of what you eat through the amniotic fluid now. Once he's born, he'll prefer those familiar tastes, so eat a variety of flavors and cuisines. You're now officially 4 months pregnant. Your uterus is about as big as a cantaloupe, which might be causing backaches and shifting your center of gravity. It might also be making it a bit harder to do household tasks that involve bending over and balancing. Some pregnant women report feeling faint or dizzy at times. Extra progesterone, which relaxes your blood vessels and all the increased blood flow going to your baby, can cause your blood pressure to drop. Rest when you need to, and make sure you're getting enough iron. Good sources include meat, fish, poultry, beans, and lentils. Between now and week 20, you'll have an ultrasound called an anatomy scan. You'll be asked to come to your appointment with a full bladder. You could be turned away or forced into a long wait if you don't. If you already have to pee every few minutes, this might sound like no fun at all. But for the best shot at seeing your baby, ultrasound techs need your bladder to be full so that it pushes the uterus up into your pelvis. Once your tech has all the pictures she needs, they'll be sent to your doctor or midwife, she should be able to give you a mid-scan pee break. This is the scan that will let you find out the sex of your baby if you want to know. But more importantly, this is also when developmental or anatomical issues will typically be spotted for the first time. Many problems that are found in utero can be treated during your pregnancy or soon after delivery. They'll also check that your baby's growth is on track. Plan to pack your patience, because you'll spend a lot of time at this hour-long appointment staring at the ceiling while your ultrasound tech clicks and clicks. Congratulations, you're going to be a great mom. Welcome to week 19. Your baby is now the size of a mango. A white waxy substance called vernix caseosa, which looks like a slathering of yogurt, has started to coat your whole baby. Some of the vernix will be gone by the time she's born, but for now, it's helping to regulate her body temperature and protect her skin from the amniotic fluid. Amniotic fluid can be quite acidic, drying out your baby's skin and making it pruny. Your baby's movements are slowly increasing. Some women describe it as the feeling of a butterfly or a goldfish wriggling around. If this is your first baby, you might not be feeling anything yet. Don't worry. As your baby gets bigger in the coming weeks, there'll be no mistaking the acrobatics. As your body's shape stretches to make room for your growing baby, you'll experience what's called round ligament pain in your lower belly. You'll also likely have an achy lower back and get some sharp pains in your hips and groin. Prenatal yoga, stretching, and meditation can be helpful, but go easy on yourself. Dizziness and lightheadedness can become common as your baby presses on your blood vessels and crowds your lungs, making it tougher to breathe. With your growing belly, you might also be having a hard time getting comfortable in bed. Try to sleep on your side with your knees bent. You may have to get creative with pillows to make this work. If your regular pillows aren't doing the trick, there are lots of made-for-pregnancy options to try. If you started to notice brownish, confetti-like patches of skin on your face, you may have chloasma, what some people call the mask of pregnancy. Rising estrogen causes an increase in melatonin production, darkening certain areas of your skin. This is more common in women with darker skin. Don't panic, it's temporary and usually fades after pregnancy. Minimize your chances of permanent damage by using sunscreen, but not just on your face. If you plan to flaunt your preg bod in the sun, slather a good SPF over any exposed skin, which is more prone to sunburns during pregnancy. If you don't already have one, you should create a will or update your pre-baby one. Most importantly, you need to choose a guardian, the person who will take care of your kids if you die, and an executor who will manage the money until your kids are a certain age. Okay, back to the fun stuff. Start thinking about what you're going to need for the baby and creating a registry if you're doing one. To check some items off your list, ask friends and family if they have anything they're happy to loan you. And of course, some generous relatives, like excited grandparents-to-be, may have a larger gift in mind. Congratulations, you're going to be a great mom. Welcome to week 20. Your baby is now the size of a slice of bread. She's sleeping and waking up at regular intervals now. Your baby continues to body build. She's busy creating muscle and learning coordination by flexing, kicking, and even flipping. You've officially hit the halfway point of your pregnancy. You definitely look pregnant now, and your belly has probably popped. If you aren't already feeling more energetic, expect a change in gears as soon as you enter what many people call the honeymoon phase of pregnancy. An increase in your vaginal discharge might also be more noticeable. Expect it to keep increasing as your pregnancy progresses. It's your body's way of keeping the area clean and bacteria-free. Yeast infections also become more common, so talk to your care provider if you notice an odor or a yellow or greenish tinge to the fluid. Your internal milk machine may also be starting to fire up. If you notice any nipple discharge, don't be worried. It's totally normal. Your breasts are just beginning to make colostrum, the yellow, nutrient-rich substance that precedes breast milk. If you found out the sex of your baby during the anatomy scan, you may have been disappointed. If you had your heart set on a particular sex, it can be hard to come to terms with what and who is actually inside of you. The good news is that you'll still have the second half of your pregnancy to get used to it. And once you see that little face in person, you'll be smitten. Around week 20, a lot of women begin to worry about weight gain. If you're going by the book, the aim is to gain just over 1 pound a week from here on out. A nutritious diet is important, but go easy on yourself. Your job right now is to grow a healthy human, not be a leggy supermodel with an impossibly adorable mini bump. Congratulations, you're going to be a great mom. Welcome to week 21. Your baby is now the size of a popsicle. Neurons between his brain and muscles are now connected, which gives him more control over his movements. That explains all the late-night dance parties that seem to be going on when you're trying to sleep. Your baby is now practicing swallowing and digesting. He's taking tiny sips of amniotic fluid and tasting the flavors of the foods you're eating. Keep this in mind as you munch on those healthy pregnancy meals and snacks, and those not-so-healthy indulgences. Babies who are exposed to a wider variety of flavors in utero often turn out to be better eaters. So if you want your little one to turn into a toddler who gobbles up his kale and carrots, you better eat your fair share now. Your bump is growing, and so is the rest of you, which may be leaving some stretch marks. Those pink, red, or purple streaks can appear on your breasts, stomach, bum, thighs, and hips. About half of moms-to-be will get them, and they're more likely and more visible if you're fair-skinned. Your chances of stretch marks also increase if your mom had them during her pregnancy. For the most part, they're beyond your control, but stretch marks can be worse if you gain a lot of weight quickly. Although there's no surefire way to prevent them, many moms swear by belly butters and oils. If nothing else, using a heavy moisturizer can help relieve the dryness and the itching associated with stretching skin. The good news is that once baby arrives, the marks usually fade. Prenatal classes can be super helpful for new parents-to-be. Not only do they cover pain management techniques to use during labor, but they also teach newborn care and the basics on swaddling, bottles, and breastfeeding. Participating with your spouse or delivery room partner can help make sure you're both feeling more confident and on the same page about delivery day. If you're having a baby shower, it's a good time to set a date for it, especially if you're hoping for out-of-town guests. Congratulations, you're going to be a great mom. Welcome to week 22. By the end of this week, you'll officially be 5 months pregnant. Your baby is now the size of a hot dog. He's big enough to be putting some serious strain on your body. Be sure to take care of yourself. Rest, take soothing baths to help relieve aching muscles and joints, and put your feet up, especially if you're dealing with swelling, which is also known as pregnancy edema. Pregnancy edema, caused by an increased amount of fluid in your body, is pretty common. Probably notice that your feet are often a bit swollen, especially after standing, and that your hands are puffy too. Word to the wise, if your rings are feeling tight, take them off now before it's too late. Minor swelling is totally normal, but severe or sudden swelling, especially in the face, is not. This can signal a potentially dangerous complication called preeclampsia and merits a call to your doctor. Are you having trouble fitting into your shoes? Swelling isn't the only reason they're feeling snug. The hormone relaxin, the one that loosens up your pelvis to make room for baby during delivery, can also make the ligaments in your feet stretch, allowing bones to spread. Many women experience an increase of a half or full shoe size, and usually it's here to stay. Some moms-to-be report a spike in libido around this time. It's not surprising because your hormones are raging. All the newfound attention that you and your cute bump are getting could also have you feeling pretty fine. Now that you've gotten used to the idea that there really is a baby on the way, you're probably starting to think about how she's actually going to get here. Have you decided whether you want to deliver at home, in a hospital, or at a birthing center? You'll also be thinking about how you might want to deal with the pain. Drugs, massage, breathing techniques, and tub soaking are all options on the pain management spectrum. If you're having a low-risk pregnancy with no evidence of preeclampsia or gestational diabetes, you could be a candidate for a home birth. Some women prefer this option because you can labor in the comfort of your own home, be surrounded by as many loved ones as you want, and avoid potentially unnecessary medical interventions. Women who have had significant postpartum hemorrhaging or have delivered by C-section with a previous birth aren't good candidates for home birth. Women who have elevated blood pressure or are carrying multiples also need to deliver in a hospital. But you still have lots of time to decide. However, if you're contemplating a mini holiday before your mini-me arrives, now's the time to do it. You should be free to fly until about weeks 34 to 36, but check your airline's policies before you book. If you're considering a maternity shoot, the end of the second trimester is your best bet for looking your big belly best. Congratulations, you're going to be a great mom. Welcome to week 23. Your baby is now the size of a carrot. If you've noticed bluish or purplish veins bulging on the backs of your legs, those are varicose veins. Unfortunately, they're not just for old ladies. Varicose veins are caused by the growing weight of your uterus putting pressure on the veins in your lower body, combined with an increased volume of blood to support you and your baby. Plus, those hormones that help your pelvis relax also cause your veins to dilate. Varicose veins tend to run in families. Chances are your mom had them too. And there's not much you can do to prevent them. To keep them from getting worse, don't stand for long periods, avoid crossing your legs, and put your feet up as often as possible. Compression socks and tights can also help by boosting circulation in your legs. Fortunately, this is one pregnancy symptom that tends to diminish after delivery. Linea nigra is caused by the same pregnancy hormones that are triggering other skin discolorations you might be seeing, like the darker shade of your areolas or the freckles on your face. But don't worry, they'll fade a few months postpartum. It's a very strange sensation the first time you notice your belly suddenly tighten, almost like a quick muscle spasm. This is called a Braxton Hicks contraction. It may be a little uncomfortable, but it's totally normal and it doesn't mean your labor is starting. Your muscles are just randomly contracting, practicing for the real thing. As long as they go away quickly, Braxton Hicks contractions are nothing to worry about. Just change positions and try to stay as comfortable as possible until they pass. Call your practitioner if they don't subside or start becoming more intense. Wondering what kinds of workouts are safe with a now prominent belly? Generally, you should be fine to continue with most pre-pregnancy exercises with a few exceptions. Sports like horseback riding, scuba diving, and anything that can involve an impact to your abdomen should be avoided. Certain yoga poses, like twists and inversions, will need to be adapted. Swimming is a great option. The weightlessness you'll feel in the pool is amazing. If you're excited about decorating your baby's room, go ahead and do it. There's no evidence that a small amount of house painting will harm you or the baby, though it could do a number on that already aching back. Just avoid oil-based paints and paint strippers, which are sometimes used on furniture, as they contain volatile organic compounds, VOCs, which have been linked to birth defects and developmental disabilities. Opt for low VOC or VOC-free latex paints. Open the windows to keep the room well ventilated and take frequent breaks. Congratulations, you're going to be a great mom. Welcome to week 24. Your baby is now the size of a burrito. Although she's still small, about 30 centimeters or 12 inches long, and weighs roughly 1.5 pounds, her features are almost fully formed. She now has fine eyelashes and eyebrows and the start of a head of hair. She can make out all kinds of sounds: your breathing, your voice, the dog barking, or loud sounds like car horns. Her capillaries are also starting to form this week, which means that her skin is becoming less translucent and more opaque as blood circulates and adds more of a pinkish undertone to her complexion. As for you, achy legs are common at this point in your pregnancy, and usually nothing more than a sign of dehydration. Occasionally, though, they can signal another issue, like a nutritional deficiency, so be sure to mention it to your practitioner. Meanwhile, make sure that you're drinking lots of water, keep moving, and stretch often. If you're experiencing tingling or numbness in your wrists and fingers, it might be carpal tunnel syndrome. Repetitive motions like typing are usually to blame, but carpal tunnel syndrome in pregnant women is often due to accumulation of fluids in your hands and wrists. When you lie down, this can put pressure on the nerve that runs through your wrist and cause numbness, tingling, and pain. Prop your hands up on pillows at night and stretch them during the day. This is the time your practitioner may suggest a screening test for gestational diabetes. Gestational diabetes occurs when a woman's pancreas isn't able to produce the extra insulin needed to keep blood glucose levels in check, increasing the risk of preterm birth and conditions like preeclampsia, as well as the odds of having a very large baby, which may require intervention like a C-section. The test measures how your body processes sugar, so you'll be asked to drink a super sweet liquid, wait for about an hour, and have your blood drawn and screened. If the results are abnormal, you'll need more testing to determine if you have gestational diabetes. Gestational diabetes can usually be managed through changes to your diet. If you're the kind of person who likes to be prepared for all scenarios, childbirth can be a tricky one. It's a test you can't exactly study for. You can attend prenatal classes and read every labor book out there, but from planned C-sections to drug-free births, everyone has a different experience, and often it's not what you expect. You may feel reassured by reading about other women's experiences or talking to friends who have gone through childbirth, but be prepared, it might be a little TMI. Congratulations, you're going to be a great mom. Welcome to week 25. Your baby is now the size of a carton of milk. His skin is still getting pinker as blood vessels develop, and he's starting to fatten up too. His nose is now functioning, allowing him to take practice breaths of amniotic fluid in utero. Many women experience heartburn at this point in pregnancy. You can thank the hormone relaxin, the one that loosens up the muscles and ligaments throughout your body, for this lovely symptom. The muscle at the top of your stomach, which is supposed to keep stomach acids from splashing into the esophagus, may be flapping open now, causing painful heartburn after you eat and when you lie down. That bigger-than-ever baby is also squishing your digestive tract, which can feel like your stomach is being pushed up into your throat. There are a few things you can do to manage pregnancy-induced indigestion. Avoid greasy and spicy foods, skip big meals in favor of smaller, more frequent ones, stop eating several hours before bedtime, prop yourself up to sleep, and pop calcium-based chewable antacids if your practitioner says they're safe for you. More than half of moms-to-be have to deal with the horror of hemorrhoids, a form of varicose veins in the rectum caused by increased blood flow and the weight of your uterus. For immediate relief, ice packs and witch hazel padsicles will help soothe your sore butt. Make your own by dampening a maxi pad with water, adding a few drops of witch hazel, and placing it in the freezer. Some medicated creams are typically safe to take, but check with your pharmacist. If you're constipated, another common symptom at this stage, getting things moving will help you avoid straining and causing added pain down there. Increase your fiber intake with more fruits, veggies, and whole grains, and drink lots of water. Some fluctuations in weight gain during mid-pregnancy are totally normal. It's unrealistic to expect the same increase at each weigh-in. But remember that you probably don't need as much extra fuel as you think. If you had a healthy pre-pregnancy weight, you only need about 350 additional calories, about 3 tablespoons of peanut butter, during the second trimester. If you're concerned about gaining too much weight, talk to your doctor or midwife about a referral to a dietitian or nutritionist. By now, you've probably picked out some baby names. Does it lend itself to nicknames you like? Are you happy with the initials? If you've selected your favorite name, seriously consider whether you want to share it. Be warned, everyone will have an opinion. Congratulations, you're going to be a great mom. Welcome to week 26. Your baby is now as big as a large side of fries. Your baby's eyes are forming, and she'll be able to open them soon. Meanwhile, her immune system is also under construction, soaking up all of your antibodies in anticipation of life on the outside. You've probably noticed that she's settled into a sleep-wake pattern too, with periods where you feel kicking and other times where she's quiet and likely sleeping. Stress and hormone fluctuations can contribute to more frequent headaches during pregnancy, as can dehydration and hunger. Be sure to take a water bottle with you for sipping on the go and eat every few hours. It's safe to take the occasional acetaminophen, but avoid chronic use. Acupuncture, massage, and meditation are drug-free pain relievers you can try. If you have a headache that just won't go away, call your practitioner. Combined with blurry vision, sudden swelling, or upper abdominal pain, it could be a sign of preeclampsia, which requires immediate treatment. If you find yourself slipping and tripping more than usual, you've got that big belly to thank. The added weight, shifted center of gravity, and reduced visibility, see you later toes, can make you prone to stumbling. Pregnancy hormones have also loosened your joints, making you less steady on your feet. Be extra careful in the bathtub, on the pool deck, and on other slippery surfaces. Keep the stairs and hallways in your home clear of tripping hazards, and watch out for your pets underfoot. A big fall during pregnancy can be serious, so report it to your healthcare provider if you do take a tumble. If you're planning a hospital delivery, save yourself some hassle by registering in advance. You'll need to fill out some paperwork with your health history, insurance, and billing information. Book a tour of the maternity ward and scout out the admitted area, parking situation, and other key spots that you'll need to locate on the big day. Do you keep losing your keys or forgetting appointments? Congratulations, you've got baby brain. Absent-mindedness is a common physiological symptom caused by pregnancy hormones. Your forgetfulness will fade postpartum. In the meantime, be kind to yourself. Set appointment reminders in your phone, leave yourself notes, and keep a to-do list. Congratulations, you're going to be a great mom. Welcome to week 27. Your baby is now as big as a slice of pizza. This is the last week of your second trimester. Your baby's brain is busy developing. You're probably having some trouble sleeping these days. Being forced to lie on your side, along with potential restless leg syndrome, heartburn, or leg cramps, can make it hard to catch enough C's. If restless leg syndrome, which can affect up to 25% of pregnant women, is keeping you awake, it can be minimized by upping your iron and folate intake with a supplement or eating more leafy greens and fortified grains. Lots of strategically placed pillows will make sleeping on your side more comfortable too. At this stage, a lot of pregnant women experience leg cramps. They're more common at night, but they can happen anytime. You're carrying a lot of extra weight, and your ever-expanding uterus is putting pressure on the veins and nerves that run to your legs. Dehydration is often a culprit too, so be sure to drink lots of water. Stop and stretch whenever a cramp strikes. When you finally do drift off to sleep, you might be having intense dreams. Nightmares are common at this stage of pregnancy. They're likely triggered by anxiety about, well, everything, from finances to caring for a newborn to imagining what delivery will be like. It can be easier said than done, but one thing you can do is try to relax before bed. Quiet your mind with meditation, a warm bath, or whatever works for you. Making a maternity leave budget or signing up for prenatal class can also help you feel like you're dealing with what's worrying you in the wee hours. Those little rhythmic bumps you're feeling every so often are your baby's first hiccups. Even though she isn't breathing yet, her diaphragm is getting ready to work outside the womb, and stimulation or irritation can cause those sudden contractions. Now's a good time to get down to business on your baby's room while you hopefully still have enough energy to tackle a big project. Begin with the basics like a crib, a change table or a pad secured to a dresser top, a diaper pail, and places to put stuff like diapers, swaddle blankets, and clothes. Congratulations! You're going to be a great mom.